joined today by Kimberly Overton, registered nurse, BSN, BC-FMP. Kimberly, I don't know what those other ones mean. Maybe you can give us an insight of that a little bit. But I just wanted to say thank you. You're a great hero for coming out and sharing this. I know we talked before the show. You've been doing this for the last 6 years, and it seems like it. I was the same way. I said, I lost 17 channels trying to warn everybody about this. But you were very heavily suppressed. We're going to talk a little bit about that. You're going to give us deep insights, on the other side, because many of us don't know exactly what was going on over there. And I think by your sharing, it helps people understand, the bigger picture of this. So thanks a lot for coming on.
Oh, thank you so much for having me. I appreciate it. Like I was saying, as we were starting the show, I appreciate being able to elevate these conversations to larger audiences. I've been out here, scratching and clawing to get my message out there for 6 years. And a lot of clips are just now going viral all these years later. So I appreciate the opportunity.
Yeah. And I like to read this one. You wrote a very, very nice article, and I'm going to pull a little bit from that. A nurse's journey through the COVID deception. She looked into my eyes, and a single tear rolled down her cheek. She knew she was dying. And the worst part is she didn't have to. I still see her eyes in my dreams sometimes, eyes that begged us for mercy we weren't allowed to give. I still get choked up.
I know. Every time I think about it, every time I think about her and so many of the other patients, I literally can't get their faces out of my head, because they did not need to die, as I said in that Substack. They truly didn't. It was, a lot of people think that it was COVID killing all of these patients. It wasn't. If we think about it, if it were the virus alone, why were we not pulling bodies off of the streets? Why were we not pulling bodies from homes? We weren't. The only place anyone was dying was in the hospital, where they were getting the treatments for COVID, which is the protocols, remdesivir, ventilator, death.
Yeah. It's tough. And, I had a lot of people that were experts like yourself that came on and talked about that. Tell us what is a BSN? I know
BSN is a Bachelor of Science in Nursing, and then RN is registered nurse, of course, and then BCFMP is board certified functional medicine practitioner. Because when I came, when my eyes were very open, I was a very allopathically trained nurse. And in 2020, my eyes were peeled wide open, and I understood that I was going to need to learn how to nurse from a completely different perspective, because everything that we were taught, as I discovered, was a lie. So I needed to learn how to practice from a more holistic standpoint, and I got trained in functional medicine, which is root cause approach.
Wow. And like I was telling you, all these years, 35 years, I was overseas protecting America from, people that would harm us, and in the hospitals, they were harming us on a level that's staggering. I saw in another show you were talking about, you were in Hendersonville, Tennessee. Is that correct?
That's right. Yes, sir.
In the hospital there. And, out of all the patients that came in, the hundreds, you said hundreds, only 2 survived.
I can remember 2. Yeah, I can remember 2. All of our patients were dying. And this was despite all of our best efforts. And I really want to make clear, because I think some people take my message the wrong way when I say, the hospitals are killing people. The deadly protocols, the protocols are harming and killing patients. That is true. But I think it's really important to understand that when you go into the hospital, most of the nurses and the doctors there are not there to harm you. They're there to heal, to help you and to heal you, and they are well-intentioned. So it's the protocols. After a while, though, you have to start understanding that if you're silent about these things that are happening, you have some culpability there, and you are complicit if you continue on with these when you know that they're harming patients. But, when these patients were coming in, we were doing the best that we could with the information that we had at the time. I started asking some questions, specifically around the remdesivir. If you understand that remdesivir is an antiviral medication, then you understand that it requires and relies on viral replication in order to be effective. But by the time that these patients were getting to us in the emergency room or to the ICU, which is where I worked, they were already well past their replication phase, several days into their symptomatic phase. Because if you remember, they were telling you, go home, you have COVID, go home, don't do anything, just, come back if you can't breathe. They're already well past their replication phase at that point. So that medication wasn't going to do any good anyway. And at the time, I will say, most of the nurses really didn't know much about remdesivir. We just knew that it was the new emergency use authorization and the new protocol for COVID. But as we started looking a little bit deeper into it, if we go back to the Ebola trials of 2008, you can very clearly see that 54% of those study participants died. I can promise you they didn't lead with that information and the supposed informed consent that we were giving these patients.
Mm-hmm. So, key word is the protocols. So I think I heard you in another show where you said you guys didn't even know where the protocols were coming from. They just came down. They worked their way down through the system, and that's what you guys had to go by.
And they changed, like every shift to shift, everything would change. Everything was different, and nothing made any logical sense. One of the first things I started questioning was the masking. They would have us wearing the same N95 mask, and we would go from our COVID patient room to our non-COVID patient room. So basically, we're just spreading COVID all over this hospital. Now, infection control policies prior to COVID never would have allowed for that. We always don and doff PPE in the patient room. We would never walk around with the same mask going from patient to patient. But that was just thrown out the window. That made no sense to me. And then they would contraindicate. They said medications like ibuprofen was contraindicated in COVID patients, but they couldn't tell us why. They had no evidence that it was causing any harm to these patients. So it was as if we were just doing absolutely nothing to mitigate the damage from this respiratory virus. We were just letting them decline and deteriorate without doing anything. No steroids, no anti-inflammatories, no vitamins, even nebulized treatments were stopped because they feared that it would aerosolize the virus. So they stopped even despite the fact that these patients were struggling to breathe without them. Wow.
And there's you have a note in one of your nurses' notes here. Here's you said cloth masks are virtually useless against viral particles.
Correct.
I think someone described it. It's like, putting up a fence and thinking that you're going to keep mosquitoes out.
Right. Exactly. The chain link fence. And that's exactly right. All you needed to do is Google the size of the virus and then match it up to the size of the particles of the mask. And you would understand that this wasn't stopping anything. The surgical mask did a little more. And then the N95 respirators, if they are fit tested, that's important to understand that they need to be fit tested. And even then they don't provide a 100% protection. What I found really interesting though, is I didn't mask outside of my shifts, right? I did not mask out in the community or anything like that because I understood that they didn't work and they actually did more harm than good. I mean, you're rebreathing carbon dioxide and you're basically putting a petri dish on your face and you're rebreathing all of these pathogens. So I understood it was going to be doing more harm than good. I did not mask in the community. Do you know that it took me 2.5 years to even get COVID? And I directly cared for these patients.
Wow.
Throughout the height of the pandemic.
So this was one of the things that we started noticing on people that wore masks for a long period of time. Mm-hmm. We started getting these skin ulcers and so forth. That must have been really tough for all you nurses.
It was really uncomfortable. Besides the fact that we just couldn't breathe in these things, but we would get like pressure ulcers on our nose, behind our ears, on our face here. Because we were having to wear these masks for 12 hours at a time. And they're not comfortable.
Yeah. Wow. And I still can't believe that we went through this. What in your thoughts, why did we go through this?
I think it was a dress rehearsal, to be honest with you, for what's to come. I think it was a test of compliance. I think that overall as a society, we failed miserably. because 90% of, probably 85, 90% of society just went right along with everything that they were doing, with all of it was like classical conditioning. If you know psychology and you understand like Pavlov's dogs, right? It's like ring the bell and they're salivating for everything. It was the same thing. And we saw it over and over again with do your part. We're all in this together. And all of these messages that were just thrown at us throughout the entire pandemic, and everybody was kind of lapping it up. And I was just sitting there very early on, just shaking my head. And it was the saddest thing I'd ever seen. People just completely living in fear. I worked in the ICU throughout that whole pandemic, and I wasn't afraid. I was not afraid of the virus. I was more afraid of the tyranny that was coming down all around us than I was of that virus.
Yeah. And, I was trying to help people understand too, because I went to, before the masking started, I was like, they're going to make us mask. So I went into some supermarket, Ralph's or something, and I wore my mask and I was videoing myself walking around. I was like, this is what's coming. Everybody's going to have to be wearing masks. And I let everybody see, everybody look at me like I had something growing out of my head or something. They're like, what a weirdo. But a few weeks later, the masking started. And everybody criticized me. That'll never happen, but it did.
It did. I was one of the lone people. Like, I would not mask anywhere. I would go into the grocery store, and most of the time they didn't even stop you. And then when one person would see me without a mask, they would take their mask off too. It just takes one person to just be brave and be like, no, I'm not participating. Not today. Of all the absurdities, though, my favorite, I have to say, was the one-way arrows through the grocery store. Oh. That was my favorite pandemic absurdity.
Yeah, definitely. And I came to pick up my son and daughter one time at an airport, and I walked in without my mask, and everybody was waiting for their bags. They had masks on. They're all looking at me, and by the time I left, no one had a mask on. It was fantastic. So it did have we were having an effect. People were starting to walk away from, I'll say, stupid. Unfortunately, I don't want to say that people are stupid, but they just got caught up in that psychological chaos that was coming at us. Now, as far as like when people were initially coming in, you said that you guys didn't understand what was happening. I was the kind of same way, as a Navy SEAL and CIA for 35 years. This was something that we all planned for and knew was coming, some kind of biological attack. Yeah. So I thought this was it. So I was like warning people, and I was like watching it. And then eventually when I got to the point, I was like, this is a nothing burger. This is nonsense. Yeah. At what point did the nurses understand that this was nonsense, but we're kind of locked in by then?
Well, I will say that we started seeing something different, like the patients started presenting differently long before they started talking about COVID. So COVID, they started talking about like March of 2020, I want to say, is when they really started to go heavy with it. We started seeing these patients that were presenting differently with a respiratory, an ARDS, like a respiratory distress syndrome, September, October of 2019.
Yeah.
And now think about that. We were not masking at that time. And again, I still never got COVID, but none of us were masking or doing anything strange. But we did notice that these patients were presenting differently, and they were requiring mechanical ventilation, and for much longer periods than we're used to seeing. We were seeing it like a week or longer. Typically it's like 2 or 3 days. And we knew that it was different. And I remember they started blaming it on the vaping. They started talking about popcorn lung and saying it was a result of the vaping. But then as time went on, we realized that this was actually COVID.
Yeah. And in Wuhan, they had a military exercise. It's called CISM, where there's a lot of competition. And I know people that are near military bases where when these guys came back, then the sickness started. Yeah. So it seems like these guys people were bringing it out a lot sooner than everybody thought. And that's a good point. I worked I was a security manager in a casino, and we had a lot of in Lake Tahoe where I'm at, And we had a lot of Chinese that would come into this particular casino, and I started seeing it very early on as well.
Yeah. And as far as like when we started to kind of question everything, for me, I would say probably March of 2020. It did not take long, but once you start seeing the ridiculous, like the lockdowns, the 14 days to flatten the curve, and all of these, we're all in this together stuff, and it just really was propaganda. And so I recognized it for what it is pretty early on, and started asking a lot of questions. I was made aware of the medication ivermectin, which I'm sure you're familiar with, and that it was demonized by the mainstream, by the FDA. They called it a horse dewormer. They called it horse paste and all of these things. But despite the fact that this medication has been used for decades safely in humans, by the way, and it had a higher safety profile than an aspirin or a Tylenol. And we saw this medication because it was being used off-label by other physicians. And we saw this working really well and mitigating the damage from this virus, yet they were completely demonizing it. And once you understand the vaccine rollout part of it, because I feel like it's like a parallel lane. We had the deadly protocols, and then you have the vaccine rollout. That's kind of a different lane. But once you understand that those vaccines that were rolled out under an emergency use authorization, if there was a cure or something that was working to mitigate the damage of COVID, then that vaccine could not have come out under that emergency use authorization. So that's really important to understand.
Yeah, very good point. So yeah, the ivermectin, hydroxychloroquine seemed to help a lot of people. I put out videos about them. They got taken down. I put out one very early on. I think it was like in January. I started talking about hydroxychloroquine, how it had really good healing properties. You could make your own through grapefruit rind, boiling it, and it had well over 1 million views all over the world. And then Facebook took it down. And then I was like, oh, why did they do that? That's an anomaly. And then I started doing the same thing in YouTube, and YouTube channels started getting taken down. Yeah. So it was they were definitely had a mission to really get this thing out there, and they obviously were pre-spreading it, as we just discussed, so that it would have more of an impact. I think when they started to push this thing, so it seemed like a much larger production. More people were involved than people really imagine at this point. So you're all the way in Tennessee. Supposedly it started in Seattle at a nursing home, which is like we're discussing already. It was already out there way before that. That was just
absolutely. Yeah. And I mean, it was a lot of the, fear is such a strong proponent for people. And if you remember, the media with the death toll ticker at the bottom of the screen, and they made people so afraid to even breathe air. The last place that they wanted to go was to a hospital. So a lot of patients that we were seeing and that we had in the ICU weren't even COVID patients. They were patients that had other issues, but they didn't want to come to the hospital because they were so afraid. They didn't want to come be near COVID, so they stayed home. And unfortunately, by the time that they would get into us at the hospital, their other, their heart conditions or their diabetes or whatever it was that they were going through was already too far advanced, and we were not able to reverse the damage of that. So it was so unfortunate and just it was such a sad and chaotic time. But it wasn't that those hospital rooms were filled all with COVID. They weren't. And another thing I really like to make people understand, if you remember, they started talking about the pandemic of the unvaccinated. Yeah. And that's another thing that is a complete and total lie, because if you recall, you were not considered fully vaccinated until 14 days following your second shot. Now, what was happening was people would go and get their first shot. They would get COVID either because of it, despite it, whatever. They would come into the hospital, they would get on the remdesivir, the protocol, they would get sick, they would die. And then they would say, oh, unvaccinated, because there was no categories for partially vaccinated. So it's really important to understand that, but we knew their vaccine status when they came into the hospital. Yeah.
And you nurses were exposed to it for a long time. Yeah. You have the people that are transporting, people to the hospital. the firefighters and the ambulance drivers, and of course the doctors. And so a lot of people were exposed to this long before, but they weren't vaccinated. There was no vaccination then.
So no vaccine. Yeah. We had been working with it for months and months and months with no vaccine. So that was what my biggest problem was. And it wasn't even that I thought necessarily that it was anything nefarious in the very beginning. The reason I didn't want to get it was because it was rolled out so quickly. We didn't have any data. We didn't have any safety studies. So I was not comfortable. And I thought, if I get COVID, I'm pretty sure my immune system will kick in and I'll be just fine. Yeah. I did not want the vaccine. I was willing to roll the dice. And then despite the fact that we all had natural immunity, most of the healthcare workers by that time had already had COVID. So they had natural immunity, but they were continually pushing this shot. And when they started pushing it for children was really when that was my line in the sand, because they were pushing the shot for children against the virus with a 99.9815% survival rate and with no safety data. That should be criminal, in my opinion. And I think that anybody, any doctor, any nurse, or any healthcare professional who said or even uttered the word safe and effective should be brought up on criminal charges, and they should be stripped of their licensure, because we had no data to say such a thing.
Yeah. So I guess there's some kind of law out there that was passed, I think during President Reagan's time, where if they approve it for vaccinating children, then they can't be held accountable.
That's correct. Yeah. A lot of people don't understand that once a vaccine is added to the childhood schedule, that removes liability protections across the board. And people don't understand that. They really, truly don't. And I was trying to get that message out to a lot of people back in 2021, that's what was happening. And that's why they were pushing so hard for these kids to get it, even though they were not at risk. They weren't even getting sick.
Wow. Now you've talked about how the intubation was for a lot of people, it was a death sentence. Tell us about how that came about.
It was, and I've been in healthcare for nearly 30 years. And I think that this is the most egregious thing that I have seen in my entire career, is these unnecessary intubations. Intubation is something that should be done as a last resort if the patient's in respiratory failure. But that's not what was happening. They were pushing for early intubation, and they were doing this not because the patient was in distress, or not because it would even help the patient, but because it was a way to contain the virus, right? If you understand, a ventilator is a closed loop system. Once the patient is on that ventilator, the virus is no longer disseminated in the air. So their rationale was to protect the healthcare workers. Well, we'd already been exposed to it by that point. So what sense did that make? And they did this knowing that approximately 80% of the patients we placed on a ventilator never made it off. So every single unnecessary intubation, we may as well have been signing, their death warrant.
And I see you made a comment about massive doses of fentanyl, propofol, and Versed, ensured that they basically were never going to come off too.
Yeah, you can't, because you have to do a weaning trial every morning that a patient is on a ventilator. You do a weaning trial to get them off and see if they can breathe on their own. But you have to get them the sedation off. And they were on such massive doses. And we're talking about things were so crazy there. And, people were not turning the meds down, and they weren't doing anything they were supposed. At one time, they actually started. I didn't do it, but they wanted us to have the IV pump outside of the room so we could minimize the interaction that we had with these patients who are already, by the way, isolated, away from their family, scared and alone. They don't even want the nurses going in there. And I was absolutely not. But they wanted us to pull the pumps outside of the room and have these like long extensions. There's no way it's safe to start making changes and titrating drips when you can't have your eyes on your patients. And that was another hard line in the sand for me, where I was like, absolutely not. But I really feel like that as nurses, we could have stopped so much of what happened. But unfortunately, as a profession, I feel like we failed in a lot of ways, because we should have stood up the moment that they told us that our patients could not have an advocate at their side. We should have said no. We should have said no. There are about 4 million nurses in this country, and we have the numbers, but too many, unfortunately, lack the courage to say anything.
Yeah, so you're going to lose your job, or be ostracized and
Yeah.
all kinds of crazy stuff. Now, we'll talk about this a little bit further. You have an advocacy. You created you have something to fix this. And so this, obviously there's this system that is very corrupt, very harmful, and you've started a new system, which is very, very beneficial. So we'll go into that in towards the end. And I applaud you on that as well, because that's something that it's critical. We have to like lead the system that's doing this. And so 96 hours, they're on a ventilator. They're basically gone. But there's another reason why they want the 96 hours. What was that?
So they would receive financial incentives if a patient was placed on a ventilator. I don't remember the exact numbers. I want to say it was around $30,000 or $40,000 maybe per intubation per patient. And then if they were on that ventilator for 96 hours or more, that payout was even higher. That was why these hospitals had to follow these guidelines, these protocols, like to the letter. Otherwise they would not get these massive financial incentives that went along with them. And what was interesting is that, depending on the state that you lived in, from COVID positive test to toe tag, you were looking at about $500,000 per COVID admission, COVID admission. And people don't understand that. I've not found a really nice way to say that hospitals were murdering patients for profit, but that's what was happening. Clearly, that's what was happening. I've always, like I said, I've been in healthcare for a long time, and I've always understood that they have placed profit over patients. But in a million years, I never would have imagined that they would be murdering patients for profit. But that's unfortunately what was happening.
So imagine if that was flipped. If you saved a patient that was on COVID, you would get the payout.
Right, exactly.
What a different world we'd be in right now.
Or apply that to anywhere in medicine. If doctors were paid only if they got people well and cured and off of medications, instead of putting them on for endless amounts of time with no plan to get them off of them. Yeah,
I would be up for that. If I got sick and somebody got me well, I'd be bonus for them. So
yeah, exactly.
Come on, let's start that process. So. But yeah, I mean, we're kind of joking around here, but this is obviously very serious. So I talked about doing this show with you, and the amount of money that some of these hospitals a lot of them were making, and someone in California, I'm not going to say the hospital name, but it's a very high-end hospital. They have many hospitals in California. He said that he was a high-end maintenance guy, so he went everywhere. And he said all of the staff, they promise each other, we will never go to these hospitals. And they started going to, like you've started, outside healthcare. And he said that that hospital that was making all this money from the patients, they created these huge new wings of hospitals and all kind of crazy stuff from the profit.
Oh yeah. Yeah, they sure did. And yeah, you ask any nurse and they'll tell you, or any healthcare professional that works in the system for any length of time, they don't go to hospitals. And there's a reason why. We understand. And even before COVID, preventable medical error is the third leading cause of death in the United States. So that's even just aside from COVID. And many people will say, well, I can't believe you would question the doctors. Well, I fear the day when nurses are too afraid to question a doctor's order, because you would be absolutely horrified if you understood and knew how many times we have had to intervene and save a patient from a doctor's order. You would be horrified to understand how many times that happens.
Wow. Well, thanks to you nurses. God.
Well, for the ones that are left, because I'm telling you, this newer breed of nurses, I'm a little frightened for, because they're afraid and they don't question anything. They just, they're not being trained appropriately anymore. They're kind of trained to be automatons.
Yeah. And you even talked about that as well on another show, where you said that they started, having these mandates that you guys had to follow. And someone would follow you to make sure you're, doing the right protocol treatment. And one time they had like a monitor on you, and you stayed a little bit longer than they, felt was good.
Yes. It's like a little low jack. They would put it on your badge, and it does. It's a tracker, and it tracks you for how long you're in like a patient room or what have you. And I actually got dinged on it because I was in the patient room. They said too long providing patient care. I'm like, how can you be in a patient room for too long providing patient care? That made no sense to me. But they're looking at productivity and all of that. I mean, I worked in an ICU, only have 2 patients. So.
Wow.
Yeah.
And so then they wanted the, no resuscitate from patients. God, tell us about that. As this is.
Yeah, that was a rough one. That was that same woman we were talking about earlier, where she started crashing and she had that tear coming down. She was a young woman. She was only 51 years old. She was a young, otherwise, fairly healthy woman. So when I say that these patients didn't need to die, listen, these patients were not frail and elderly patients. They were young and healthy. And so she was a full code when she came in there, as young as she was and as healthy as she was, but they kept pushing. They wanted to call the family, and because she had coded several times. Her heart had stopped several times. We got her back, and they just kept pushing. They wanted the family to make her DNR, and the family was very adamant that they were not going to do that. Her children were very adamant, but they kept pushing for it, and I had a real problem with that. That we were just going to just make them all a DNR, just let them die, and then make room, open up a bed, and make room for your next $500,000 COVID admission.
Wow.
Yeah.
God, that's crazy. So that was, and to get the family to sign the DNR, it's like, you want to see your family, loved one for one last time, sign this DNR.
Yes. So what would happen when they would say, oh, we cannot have any visitors up here because, of course it's the deadliest pandemic we've ever had. Right. But as soon as you made that patient a DNR and put them on comfort measures only, then they would let the family come up. So which is it? Is it the deadliest pandemic known to man, or does it not matter once you make this patient a DNR? So that was another thing that really bothered me and again made no sense.
Yeah. And the PPE, the personal protection equipment, you talk about how there were standards that you guys had, which makes complete sense. You're in one room and you don't know what this person has, or if they do have COVID, you don't want to
bring a styrofoam cup out of a room. Like, you cannot, infection control policy doesn't allow you to do that. You can't take a cup out of the room and refill it. Now you have to get a new cup every time. Wow. But yet it was all of a sudden it was okay that we could be wearing the same mask. And again, people were thinking, oh, that's just a COVID unit. That's not correct. We had both COVID and non-COVID patients on our unit.
Yeah, and one of the arguments was we don't have enough PPE, but you talk about how they had tons of it down in the basement.
Oh yes, yeah. They kept it under lock and key. It was ridiculous. And then the doctors, who we could barely get it was pretty funny. We could barely get the doctors on the floor. And they would say, oh, we're trying to preserve the PPE for the nurses, but they were literally afraid to come up. They were taking the nurses' assessment, or they would, maybe we had some of the intensivists that would come up, but the regular doctors that would round, they would not come near that floor during COVID. And under the guise of they are saving the PPE for the nurses, but they would literally ration it out. And every day when you would start your shift, you'd have to go down. It's under lock and key, and you get your 3 masks. Typically we work 3 12-hour shifts. They would get the mask. They would have us put the mask in this magical brown paper bag that supposedly sanitized. I'm talking like a lunch bag, right? Oh. They would make us put it in that, and then that would supposedly make it all, sanitized and fine for the next shift.
Yeah. And there was, I heard in one of your interviews where you would come in, you would sing to the patients. That was beautiful.
Yeah, I don't know how beautiful they may have thought it was because you've never heard me sing, but yeah, I would. I can't remember going in. It was Christmas time, and yeah, they were not wanting us to be in the room. Like, they wanted to just minimize cluster care, is what they would call it. Get everything done, get in, get out. And I would just take my charting and my stuff, and I would sit in the room with my patient, and I would sing to them, or because again, they had no visitors. They were alone. They were afraid. And it's so important. And I always tell nurses, make sure that you are talking to your patients, make sure that you're navigating the care that you provide to people. I don't know if you're familiar with Drew Brophy. He was in a coma for about 78 days. He was on a ventilator, all of these things.
I saw that show that you did about him. That's incredible.
Yeah, his story is really incredible and amazing. But I can remember interviewing him, and he said, he was very aware. Even though we're looking at him, he's sedated and all of these things, they're very aware of what's happening. So can you imagine even being just like peripherally aware? You have all of these people coming at you and doing all of these things and just not talking to you, not letting you know that you're in the hospital, that you're safe, you're in a safe place, and we're taking care of you. And a lot of times nurses don't do that because they feel like their patient is sedated and can't hear you.
Yeah, and he was talking about how he could hear, them talking about he was going to die anyway, and it's bad.
Yeah.
And that one, not a nurse but a practitioner for the lungs or whatever, she came in and she's like, just let me work on him. Come on, just let me work on him. And they finally gave in, and she saved him.
Yeah. And so I think it's really important. And I learned that very early on in my career when I had a patient and they were intubated. And then the next shift that I came in, they were off the ventilator. So I went in and I said, well, I'm going to reintroduce myself because, I had you last night, but you were sedated and all of this. And she was like, oh no, I remember you. She's like, I remember your voice. I remember you holding my hand. I remember you telling me everything was going to be okay. And from that moment on, I never questioned whether these patients could hear what we were saying.
Yeah, that's consciousness on a different level, and you get to experience that. That's beautiful. Yeah. But it's the system doesn't care about that. They just want the numbers, obviously. Now let's kind of move into the next phase of this, where they started to do the vaccinations, and this is even more troubling in some cases. What was happening? What happened?
Yeah. So December of 2020 is when they started rolling out the vaccines. And like I said earlier, it's not that I thought anything nefarious was going on. It was really rapidly deployed, and I was not comfortable with the fact that there was no safety data. So I made the decision early on that I was not going to take the vaccine. And I can remember them coming around unit to unit. The nurses, they would send the nurses into the night shift, and they had a huge box of vaccines, and they were really putting the pressure on for us to get these vaccines. And I just kept on refusing. They're like, oh, you have to do your part. You have to protect your patients. They made you feel like you were like a horrible nurse and a horrible human being for not wanting to get it, even though despite the fact it did not prevent transmission, which by that time we already knew it didn't prevent transmission. Yeah. But they kept on, and I just dug my heels in. But what was worse, Michael, was that it's not just they wanted us to take the vaccines. They really wanted to make a spectacle out of it. Like they wanted us to create videos. They wanted us to do PSA videos and photo shoots of us getting the vaccine. And it was absolute insanity. And I wanted no part of it. And that's when that came down, all of these mandates, it hadn't come down to affect me at that point. I worked for a large hospital corporation, and they were not pushing. They were highly encouraging, but they were not mandating at that time. Mm-hmm. So I just kept saying no, and they were like, whatever. But I saw a lot of my other friends in the industry that were being fired. If you remember, it was like the nonprofit hospitals, the not-for-profits. They were the ones that were mandated first, and they were threatened with losing all of their federal funding.
Wow.
So when I saw all of my brothers and sisters, nurses, being fired, I knew that we had to do something. Mm-hmm. So I started Nurse Freedom Network, and it started as a Facebook group. It was just a place for us to kind of come together and try to figure out how do we navigate these. It was just completely uncharted territory. And it just really quickly grew. I started protesting at local hospitals. It was just myself and a sign I had made up that said Nurse Freedom Network with our logo and a bullhorn. And then I got some other nurses and other friends to come to the hospital. And I'm in the Nashville area. We went and protested at St. Thomas, which is a religious institution. And they were denying religious exemptions for the vaccine, which I thought was really funny. but yeah, we started this protest in local hospitals, and it just really caught on it because we started building advocacy teams across the country where people were out and doing these protests around the country. And I don't know how I started getting a little bit more national attention. I ended up speaking at, I was at Defeat the Mandates in both DC and LA, and I was able to speak out at, I've traveled for the last 4 years speaking out at any event I could get to, any conference I could get to, any podcast. And in fact, the clips that have gone viral now, a lot of people are just now seeing, as we were talking before the show, that I've been very suppressed for years. Voices like mine have been, dismissed, ridiculed, deplatformed. But all of a sudden I see these it was a Truth Tour event. And I think you've been on the Truth Tour as well, right? Am I correct? Yeah. It was a Truth Tour event that I spoke at in San Diego, California, back in, I believe it was 2023. And those clips have been going viral lately, which is what got the attention and brought me to like the Jimmy Dore show. And I'm sure, it sounds like you saw my interview with Cornelia.
Yeah, that was a great interview. Fabulous.
Yeah.
I'll put the link to that in the description box, which I have all your links as well. Now, that's very touching. Some of the things in your post, the Nurse Freedom Network, Substack.com. So I highly recommend everybody go check that out. It says, I witnessed with my own eyes the devastating impact of this coercion. So they're basically telling you, if you don't comply, if you didn't comply, you lose your livelihood, you lose your family's going to be threatened, so forth. Protect your patients, do your part, just really pushing it hard. You watched a young pregnant coworker, someone who desperately did not want the shot, stand crying as they prepared to inject her. She wept openly, torn between protecting her unborn child and protecting her job. She felt trapped, powerless. They made her believe she had no choice. So this is the kind of stuff, that's infuriating to, many of us when we're hearing this, but now we're hearing it, on another level. So did that woman survive, I hope?
She did. And I can remember literally praying. I prayed over her. I prayed over that baby as they were injecting her. Nice. And that I didn't know what else to do, but just pray for her in that moment. But I was devastated. And I honestly wanted to go punch the nurse in the face that was doing this to her, because she so clearly did not want it. I'm all about informed consent. And if somebody made the choice to get it, fantastic. But she didn't want it, and she felt like she had no choice, and that just made my blood boil. But I just prayed for her in that moment. She's fine, and as far as I know, her baby is fine too. Thank you, Jesus.
Hey, good job. All right, good to hear stories like that. But we unfortunately have stories that didn't turn out so well. You're perhaps seeing more of that than I do these shows, and I have people come on and talk about the horrors of people that have had the shots and what have happened to them. They've massive numbers of family members they've lost, and hardly anybody realizes it was from the shot. Still, it's like, wow,
right. Nobody's connecting the dots, and we were seeing the injuries at the bedside very, very early on in the rollout. I remember we were seeing the patients come in, heart attacks, blood clots, strokes, GI bleeds, and these are in populations you would not expect to see them in. So we were seeing that very, very early on, and which is why a lot of the nurses were like, "No, thank you, we're good." And I was horrified that these shots were not being pulled off the market immediately. I couldn't believe that they were pushing them, and then booster after booster. I think we're at like 16 boosters now. It's insane. Oh. Yeah. I'm horrified that these were not pulled off of the market back in 2021, because the short-term data that we had was extremely alarming, and we had so many safety signals. And the reports that were made to VAERS, which, by the way, VAERS, the Vaccine Adverse Reporting System, only captures around 1% of the data. Yeah. Only about 1% of the data. Many studies that have shown that it's not capturing it. So,
yeah. In your estimate, how many people do you think of? It's hard, but how many people do you think have actually died from the vaccination?
I couldn't tell you a number, but I think it's I think it's catastrophic. And I think that, what's really unfortunate is that we're not going to see the full ramifications of what they have done for decades. If we start thinking about the babies in utero, the pregnant moms that got this, we're not going to know what that impact is on fertility long-term for decades. So we're not going to know the full impact or the full scope of what they've done for a really long time. But unfortunately, we had that kind of period of time where we were just seeing people just drop, right? We were just seeing people drop died suddenly everywhere, right? But now we're also seeing that increase in the turbo cancers and just other really rare things. I will say, I've been in healthcare a long time. I'd never seen so many cases of like adult appendicitis or adult strep throat, because we were destroying immune systems with these shots. And it's a cumulative effect. Every time you get another shot, you're just doing more damage to your immune system, so that people were becoming more susceptible to like bacterial infections. And, sepsis is the new thing that's taking everybody out. So it's because we destroyed immune systems.
Incredible. No, I know a lot of nurses and doctors that have walked away from the medical establishment because they were mandating vaccinations. At what point did you leave?
So I was actually exempted from I had left the bedside because I couldn't, I was not mandated at that point to take the vaccine, but I just couldn't do it anymore. My heart could not take it anymore. I could not watch one more of my patients needlessly die, particularly when I knew that there was medications out there that were helping. So I walked away. I started doing telephone triage nursing, which I thought would be a good alternative for a while. It was for a while, but there again, I started becoming uncomfortable with the protocols that they were asking us to use. They wanted us to recommend that vaccine to children, and they wanted us we literally had a scripted answer. We had a scripted answer. If somebody called and said, should I get this for my child? Our answer was to be, yes, the vaccine is safe and effective, period. We had no way of knowing that. We had no safety data, no long-term data. And again, like I said earlier, the short-term data was alarming. That was my line in the sand. I had at that time been exempted from the vaccine because I was a 100% work from home employee. But I resigned because I couldn't do it. I couldn't sleep at night. I would not tell people to get the vaccine. I started talking about things that were really taboo, like natural immunity and all of these things that are not considered appropriate to say to patients. I figured they were going to fire me eventually. All of those calls are recorded. But I called my supervisor and I said to them, I said, I know that you listen to these phone calls that we get. And we were getting so many phone calls, again, from like young, healthy people that were having heart attacks and strokes. And all. I started keeping my own data because I was seeing so much of it. And I was like, how can you continue to not say anything? So I resigned in protest of all of that, and I decided I wanted to just dedicate my life and my mission to growing Nurse Freedom Network, and then eventually that became Remnant Healthcare. So Nurse Freedom Network is a 501c3 nonprofit, but alongside of that, I knew that my vision was more than just advocating. That it was to create opportunities for nurses who just are ready to come out of this broken system, and also to provide compassionate and patient-centered care, but using a different modality. I think one of the most depressing parts of being a nurse, particularly in the ICU, and this was even pre-COVID, was that about 85 to 90% of everything that we see come through those doors is completely preventable with lifestyle modifications. But the system is not designed to keep anybody well. Right? It's there to manage symptoms. So I knew there was a better way, and I wanted to offer that to people. Nurses in general, we're very solution based. We can identify the problem which we have, and we can keep on talking about it and staying pissed off at the world and the people that did this, or we can start bringing forward solutions for people. So we do offer, it's private membership association. It's $30 a month to join. You can cancel anytime. That gives you access to all of our protocols, programs, and services. I hate the word protocol. Let me back that up. I don't like that word protocol, but programs and services, which we also offer advocacy services. So if you are in a position where you don't have a choice and you have to go into the hospital, our advocate's going to be right there alongside you throughout that journey. And we have seen firsthand the difference that that makes when you have a well-educated advocate who knows how to navigate the complexities of the system, that they are not going to be able to gaslight you and shame you and pressure you into things like intubation and all of these unnecessary treatment modalities.
Fantastic. And that's definitely worth becoming a member. We're definitely going to become members because advocacy, I think, is
it's huge.
If you don't have that, tell us what could happen.
Right. And I tell people all the time, you know, we're certainly far from the only advocacy services. Others out there, whether you use our organization or another, just please have an advocacy plan in place. It is so important. Do not go into a hospital without an advocate. And it's I don't care if you're a nurse or you know how to, it's different when it's your family member or it's yourself. You really, really need to take that emotional component out of it and have a professional advocate that can stand in there. I can't even advocate for my own family because I get too excited. So
wow,
I get a little too emotional.
Because you know, we were trying to help people in hospitals and they blocked us. There was no one could go in and save them. It was crazy. But I talked to other people that were doing advocacy like you're talking about. And they were able to go in and, and for these people and get them out of the hospital into another service or get someone in there, a doctor that knew how to treat them correctly. But if you don't have an advocacy, you don't have any, they could inject whatever they want into you, because once you walk in that door, then they own you.
Exactly. And another thing that is just talking about the advocacy services, it's something we don't talk about enough in this country, is that we've completely tainted our blood supply with so much of this population being vaccinated with at least 1, 2, however many doses of the COVID vaccine. So they don't differentiate between vaccinated and unvaccinated blood in the blood banks, unfortunately. So we do partner with an organization called Pure Blood Registry. We've also worked with organizations Blessed by His Blood, and there's others, Safe Blood. So there are a couple of different ones out there. The one that we mainly work with is Pure Blood Registry, but we partner with them. We advocate for their members, and we facilitate that directed donation process. That is something, directed donation is not something new. It's been around for decades. It's not anything new, but they are really, really pushing back against these now. So it's very important to have that advocacy plan and that advocate in a position that can fight for you for that, because we have 100% success rate in getting those directed donations for our patients and our clients.
Excellent. And I see you have a vaccine injury program as well. What's that about?
We do. And we deeply discount our vaccine injury program because we understand that the vaccine injured most of them have been financially devastated by their injury. So all of our prices are very, very affordable, because we understand that, healthcare should be accessible to everyone. But we do have a homeopathic detox protocol that we have been using in conjunction with, it's called getdetox.us. The formulator is Jen Dillon, who's absolutely brilliant. We've been working with them. And a lot of the clients that we've seen about an 85 to 90% symptom reduction on this protocol after using this protocol. So we're seeing really wonderful results, and it's interesting. It's optional, but there is a blood test now that can check the presence of the spike protein. And after 8 weeks on that protocol, they retested, and that spike protein was eradicated from the blood.
Wow.
So that was interesting to see.
Good job. So you also have you can get nurses to come into this program as well. I thought this was phenomenal.
Yeah. So it's not just, it's the benefit of this organization is really twofold. Yes, we're serving, the people that need an alternative to this broken sick care system, but we're also creating these opportunities for nurses and other healthcare professionals as well, who just are ready to step away, whether that be as an advocate. All of our nurses are trained in functional medicine. We partner with Functional Nurse Academy, Melissa Schreibfetter, who's amazing. She founded the Functional Nurse Academy. We partner with them to get all of our nurses trained. It is the most comprehensive, duly accredited functional medicine program. There she is, this Melissa, on the market. it's so valuable, and it's affordable. I mean, it's a 6-week program. You can get that board certification as a functional medicine practitioner. And we even have partnered and bundled our services so you can join Remnant as a practitioner once you've completed your functional medicine training. So yeah, we have homeopaths, we have naturopaths, we have functional medicine practitioners, and we're actually getting people well. And it's amazing. It's amazing how fulfilling that is. And it reminds me of every reason that I became a nurse to begin with, and that's to heal people and to help people.
Wow, that's phenomenal. Yeah, love this. This is amazing, Kimberly.
Thank you.
This is what we all have always thought our sick care system was about. But
wanted our nurses to be like, not.
Yeah. And I have to say, I have the most, I got to shout out to my team. I have the most amazing team of advocates, of nurses, the heart on these incredible nurses. I can't begin to say how grateful I am for them, because they bring my vision for Remnant to life every single day with every interaction with our clients. And I'm just beyond grateful for them.
Excellent. Well, thanks so much for your work. Any last thoughts or comments?
Again, make sure you have an advocacy plan in place. It is so important. You can visit our website. It's remnanthealthcare.org, or my Substack. Again, I'm sure you'll include all this in the show notes, but nursefreedomnetwork.substack.com. And also I do host the Nurses Report on the America Out Loud Talk Radio Network, and you can tune in every Wednesday at 10 a.m. Eastern. And
nice.
Thank you so much for having me. And I hope everybody will share this widely, because these conversations need to be elevated, because what we went through in 2020, what they've done once, they are going to do it again. I promise you that. And we've got to do better this time.
Yeah, good. And if we have an alternate system like you're building, then we don't have to go to that one. And that's, I think everybody wants that. So
I think if there's one last thing that I'll say, it's mass non-compliance. That is the only way forward. Do not comply. Whatever comes next, do not comply.
Thank you. Thank you so much, Kimberly. And again, thank you for your courage to come out from the beginning and still keep doing it and building a system that's, an option for this sick care, real healthcare. So beautiful. Thank you so much.
Thank you so much. I appreciate you.